Hello, my name is Kimberly Allen, and I'm here today to talk to you about the role of peer recovery and family support in optimizing integrated health outcomes. And this presentation is part of a segment, this is number 6 of 8, on how peers can create understanding amongst professionals. So this is about how we as peers, I am a peer myself, can go out and talk to other professionals about what we do. This is part of a program put on by Texans for Recovery and Resiliency, and TRR is a SAMHSA-supported collaboration between the Family Mental Health Network, which is the Texas Federation of Families for Children's Mental Health, and the Addiction Recovery Community statewide network, RecoveryPeople. And the purpose of this collaboration is to strengthen peer and family voices in mental health and substance use recovery policy and program development. So today we're going to talk about creating understanding of what peer supporters and family partners do to give you an idea of who would we normally be talking to about this. We would talk to registered nurses and nurse supervisors who often manage peers in hospitals. We would be talking to directors of care management. We would talk to clinical and care coordinators, social workers, peer support supervisors, and peer facilitators and trainers. All of these titles are things that you'll hear in private health settings on who manages peers today. So when I say private health, I'm talking about medical, I'm really talking about hospitals and acute care settings more than anything, inpatient, psychiatric units, things along those lines. So when we talk about peer-driven wellness approaches, peer-driven wellness-oriented approaches should be considered an important complement to an integrated care team model. So we're a complement to a medical model. We need to be clear about our focus on wellness and how we may be integrated. And more than anything, we need to avoid cultural clashes. So we're going to train champions in peer support core competencies. So once again, those are nurses. It does include office managers and clinical staff. They tend to be very interested in what we do, even when they don't completely understand it. I've had a positive response in these interviews, these telephonic interviews that I conducted from all of these areas. Office managers make a lot of referrals. So they're the people that are doing outbound referrals from medical clinics, and they were interested to understand more about peers. So I asked the leader, the administrator of a 50-plus bed psychiatric unit that's part of an integrated care system about who manages peers, because he has peers in his entire integrated system. And he said the most recent was a social worker and a peer support supervisor. So he actually has a supervisor that's there strictly for peer support, also a nurse supervisor. He did this until he was making sure it was operational, and he has a facilitator trainer. So he uses those trainers to keep his peers current. One thing that he does is conduct wellness recovery action planning. So those RAP plans that you may have heard about are something that they train in. All of their peers are certified. He made sure that I knew that. And here is who supervises them. So in this group, they know who peers are. So we want to be mindful of that. That when we go out and talk about what we do, this is typically who we're going to be talking to. So this is a director of nursing. It's a separate organization. It's a 500-plus bed hospital. This director of nursing says we were convinced that peer navigators would be invaluable in helping our patients receive the care they deserve. I was a champion for the program. She was very proud of that and should be. You'll hear that word more than once out in the market that's out there in business. People are known as champions for the peer program. They really get behind the program. And as a nurse, she really felt like that peers needed to be in the ER, the psych ER, and the hospital, and she was right. They have had very, very positive outcomes related to this. This is a managed healthcare company. I wanted to know more about how they train peers on what they need to do in managed health environments. He said, we have a staff training that our consumer affairs department puts together for training all care advocates. Care advocates are clinicians. So they have a staff training that their consumer affairs department puts on for care advocates, or at least that was my understanding, that care advocates were clinical. They want to train them on what support is and what it's not. So what we're not as clinicians. So he was very clear about that, not just on what it is, but what it's not, so that we can help clarify ourselves, training on how it's helpful, how to explain it to members. Members are covered by insurance, and the process of getting referrals. We do periodic retraining for new employees, but it is not mandatory after that. So if you are a new employee of a managed healthcare company and you don't know what peer support is, they train you on that. They train you on what it is, what it's not, how it's helpful, how to explain it to covered members, which means people that are covered by insurance, and how the process goes for getting referrals. And MCOs get referrals from telephonic hotlines and websites that they set up for people to call in and receive assistance. So after that, though, they don't retrain their new employees. So I view that as an opportunity for us to perhaps train them on current things in peer support. So there that is. But they do tend to be quite current on peer support. I learned that throughout this interviewing process. This is a director of nursing from a 500 plus bed hospital. She said, it did take time to educate our clinicians about it. I was an advocate to educate clinicians to ensure that our patients are at the center of all that we do. Peers are no different than breast cancer. There was no original education to our providers. It's going well, however. The psych ER is now embracing peers. Peers are often more effective than a clinician. So you can see her response to peers, often more effective than a clinician. So of course she's an advocate in terms of feeling that way. She's letting us know that it does take time to educate the clinicians, that is not something that happens overnight. And she was the advocate to educate those clinicians, and peers are no different than breast cancer. So this is a very educated individual on peers and how she seems, how she sees addiction and mental health conditions. So she's talking about that, and that the providers had no original education. Once again, I see an opportunity here to where we can go in and provide education to healthcare providers on all levels. So here's what we can do. We can describe peer support state certification. I heard from numerous organizations, and as a matter of fact, all that I interviewed, that they use certified peers only. So we can go in and talk about how we're certified, what our education and certification process looks like. We can show clearly defined roles on what we do. We can describe our key functions, and we learn a lot about that when we're being certified. We can show peer and family supporters sample job descriptions. Those do exist. There are multitudes of them. So I have my contact information at the end of this presentation if you would like to see a sample job description on what we do. We can describe the lived experience piece. Certainly it differentiates us that we have the actual lived experience of being in recovery ourselves from addiction and from mental illness. So we have that piece that we share, and thus there is stigma reduction. We can describe our collaborative goal setting with patients, how we go about doing that. We actually collaborate with the patient, which is what they call the individuals. That is not a word that we always use, but I am using the language that's often used in acute care and in hospitals. So we have collaborative goal setting with patients. We can describe how we help patients to develop action plans that are very specific, and how we assist patients with self-management so that they manage day to day. As you can see, as one example, the hours that they slept, if they're anxious, if they're irritable, if they've used alcohol or drugs, if they're working out, anything unusual, stressors that they have. So we can help people to develop action plans to work within what's a stressor for them. So when we educate people, we can illustrate activities of peer supporters inside clinics and beyond. Pardon me. A lot of times people talk about peer supporters inside medical environments, but we want to talk also about what we do as patients discharge from medical environments is a very important segment of what we do. We also help people before medical appointments. We would show how peer supporters and family partners help patients to prepare for medical appointments. We can gather data on other appointments that they've had, medicines that they may choose to take, what they're eating, what they're drinking, things along those lines. We can describe that we help patients understand clinical instructions once they're given those. We can stress the importance of helping patients keep appointments post-discharge from medical or mental health treatment environments, particularly during times of transition. Times of transition are very stressful and difficult, whether we're discharging from a medical hospital or from mental health and treatment for addiction. So we can talk about how we can support people during those times of transition. Many, many patients are lost due to transitional stressful times. We can show that we're transitional guides into the community, show that we promote access to resources, and once again, talk about stigma reduction as these patients move throughout the community, and we assist them in that effort. We can promote family engagement and support. We don't want to forget this. How do we do this? We can describe actual family stories, and we can emphasize the frequency of interactions with the families. We do a lot of talking to families, and we want to make sure that people know that we do that often, and describe those stories of how families have been supported and assisted. So overall, we support people in their recovery process. We help them to build resiliency, and we provide direct support. If you'd like more information, please view the other videos in this series of 8, or contact me, Kimberly Allen, at RecoveryPeople.org. We also have a website, RecoveryPeople.org, as well as Recovery and Resiliency.org. Thanks for listening today.